Welcome back to Navigating Cancer. I'm Dr. Joey Bennett, and I'm joined by Wendy Hall. Today we're talking about skin cancer and the importance that skin cancer means to us who live in Florida. I mean, it's a critical situation with the sun exposure, with all the beautiful days of sunshine that we have here. We need to understand the risk of sun exposure, and now what I want to do is turn towards the treatment of skin cancer. There are several different options that you have when you start looking at skin cancers, and the first part really depends upon whether or not the cancer is invasive or just superficial on the skin. When you have invasive skin cancers, we look at the treatment options on this slide, and the first one that almost everyone knows about is surgical excision. Your primary care physician, your general surgeon, your dermatologist can surgically excise most skin cancers, and depending upon where they are, the cosmetic results are just fine. But surgery is not for everyone, and we'll get into that in just a moment. Another option is radiation therapy. Radiation therapy is extremely effective at treating skin cancers, and we treat a lot of people in our office at Lecanto at the Allen Ridge Complex for skin cancers. It's extremely effective when you start looking about cancers around the facial area, because cosmetically our results are better because you don't have the scar that you can have from the surgical excision. There is a drawback though, because it can take more time to treat that cancer. When you go and have a cancer surgically excised, you're typically in and out in one day, you're finished with your treatment, it's very easy. You have to go back 10 days later maybe to have the stitches taken out. The other options that you see on your screen, which is cryotherapy, which is freezing of the cancer, or chemical treatments, are really used for very early non-invasive cancers, because if they're just on the surface of the skin and you freeze them with liquid nitrogen, or you use some topical compounds, one known as like Effudex, they apply a nice dose of treatment to the very surface, and a lot of times these things will literally just flake and peel off. If it's invading down deeper though, those liquid nitrogen treatments and those chemical ointments are not going to work. You need to be looking at either surgically removing it or doing radiation. When you look at these two treatments, especially from the standpoint of basal cell carcinomas and squamous cell carcinomas, as you can see on this next slide, a thorough review of the literature will tell you that the treatment of squamous cell carcinomas and basal cell carcinomas are equivalent to each other. The cure rates approach 100% with either one of them. So it really comes down to, where is my cancer? How big is my cancer? What am I looking to get out of the treatment for my cancer? Am I looking at a good cosmesis? Am I looking at getting it done in one day and getting out the door? Which one is the most convenient way for me to handle this? And you see it every day. There are certain people who have jobs to where if they went and had surgery done, they might not be able to work. There are other people who have jobs that don't allow them to come in for daily courses of radiation treatment when they're trying to get their cancer treated. So there are factors that come into it as far as the location of the cancer, what you're looking at, but also the person. I mean, we have to ask people which one of these sounds best to them from their standpoint.
Right, and that's the great thing about this show, is that we can explain things like that where, you know, I've had people in our office say that they didn't know what really all the options were. And I have a question about even basal cell. What happens if we notice it and it might be cancer and it is really basal cell, but we don't do anything about it for a long time?
Well, I mean, basal cell is that one cancer that can give you the opportunity to maybe do that, because I've had people before have basal cell cancers cut off and they think it's coming back, but they want to watch it for a little while, and they're so slow growing you can get away with doing that, because the worst thing that happens is it gets a little bit bigger. We do not watch squamous cell carcinomas when we think they're coming back. We do not watch melanomas, because we know that if you simply continue to watch those cancers, they can spread, and all of a sudden you've got someone dying of a cancer that they should have never died of in the first place. So next I want to talk about some of the things that I try to talk to patients about when we're looking at what the best treatment for them is, and it's kind of like selecting the treatment based upon what your priority is, and there are several different things to look at. First and foremost, what we're worried about most is the cure. That is absolutely the most important thing. You want to cure the cancer, you want to get rid of the cancer, but at the same time, you want to look at what your function is like after you have treated that cancer, and you want to look at what your function might be like while you're having the treatment done. If you have a job that requires manual labor and you can't be off work for 6 weeks to let an incision heal in your hand or something like that, then radiation provides you with an alternative. However, if you can't come in every day for treatment, but you can have the stitches and you can rest the hand, then you may want to go with the surgical side of things. The other thing you really want to look at, though, is cosmesis. We have the capability, when looking at radiation, of treating these cancers with very little scarring and excellent cosmetic results. And so when you start looking around the face, the eyes, lips, nose, and ears, I think we have a tremendous advantage over surgery, is that you will look very good once we have finished up the treatment. And so on the next slide, you'll see the things that we really try to look at. We try to look at what is the anatomic location of where this thing is. How big is it? Is it recurrent? Does a person have other medical conditions to where they're taking like blood thinners and it's not safe for you to stop your blood thinners to have a skin cancer cut off? And then finally, the mobility of someone. If someone is very immobile, you're not really anxious to do a big surgical procedure on them, because there could be complications from just lying in the bed all of that time. So those are the things that we look at. We try to let everyone know that there's not just one way to treat skin cancer. Yes, you can surgically remove it. Yes, you can radiate the cancer, but which one is best for you based upon your activity level, what you do, how active you are, what your job is, and mainly, I think, where the cancer is located. If I've got it on my nose, I think I'd rather come in and do the radiation than have a scar on my nose for the rest of my life. And one of the advantages that we have, and I brought these along to show you tonight, at the Robert Boisnot Oncology Institute in Lecanto, we have an applicator that's called the Leipzig applicator. And what you do, and I'll use Wendy as an example here. Wendy's had this spot that I've been watching for years and years, and it's benign. But if that were to be a cancer, what you do is you come into the office, we literally put the applicator right on top of the skin, and it treats the cancer for about 3 minutes, once a day for 10 days. So 30 minutes of treatment, once a day over a 2-week period of time, and you get a little bit of a sunburn reaction in the area, but it helps to cure that cancer. We have 2 sizes of this applicator. And one is 2 centimeters, the other one's 3 centimeters. So we can use this when we have small tumors, but if it gets to where it's larger, we can still treat you with radiation, but it ends up now being about a 4 to 6 week course of treatment. So I hope that throughout this program we've given you the information to realize that skin cancers are dangerous, they can be deadly, but they're highly treatable. Please send us an email if you have a suggestion. You can call our phone number at 527-016, and you can visit our website at www.rboi.com. We hope you enjoy the program, and we'll see you next week.